We have a question from Carter from Maryland, and we all visit Maryland. Jennifer, can you answer? Can you provide us insight into the negotiations process? Why did congressional leaders join the president for a meeting this afternoon if Congress controls the purse?
Well, that's an excellent question. I think that is because the Republicans that control Congress have been doing the bidding of the president. And so there's really not a lot of point in negotiating with congressional Republicans when they're just going to bend the knee and do whatever President Trump and his administration says to do. So I think the first step is making sure that the president and congressional Republicans, who, they control both branches of government, making sure they understand that Democrats have been ready from day one to pass a bipartisan funding bill that meets the needs of the American people and that addresses the pending healthcare crisis that Republicans caused. And yet they have, from day one, not been interested in talking to Democrats, in negotiating with Democrats, and they have cut us out of the process from day one. So the meeting today first was to see if they actually would meet with Democrats, because it was scheduled, it was canceled, it was on again, off again. But once the president agreed to meet, to make clear he understands what the Democratic position is, and that is, once again, we stand ready to pass a funding bill that meets the needs of the American people and addresses the healthcare cliff. But so far, Republicans aren't putting that on the table, and they're the ones, as they've made clear, who are in control. Yeah, and I would add on the rural piece, we know a lot of our rural healthcare providers, especially our hospitals, are already on the margins and providing uncompensated care or care to a lot of Medicaid patients. And so with the cuts to Medicaid in the big ugly bill, we're beginning to see rural providers close as a result of that. We saw 3 in Virginia close just last month, and they specifically said it was because of the Medicaid cuts. But the important piece is people on Medicaid, that's their health insurance. So when you see millions of people who lose their health insurance because of Medicaid cuts, and then you see people who can't afford their insurance under the ACA anymore because their premiums have gone up because these extended tax credits have expired, that's up to 15 to 17 million Americans that the CBO estimates will lose their health insurance, but they're still going to get sick. And then when they get sick, they're not going to pay for preventative care. They're going to wait until they can't wait anymore. They're going to show up in the emergency rooms. And that's going to put that much more stress on providers and on our rural areas where the providers already are barely covering their costs, if they're covering them at all. They're going to shut their doors. And there are hospitals across the country, 6 in Virginia, that have said that they're at risk of closing their doors because of how many people are not going to have health insurance. Now, in these rural areas, one of them is in my district in Emporia. In these rural areas, they've already lost employers. The hospital is one of the largest employers in the area. So in Emporia, if they lose their hospital, they've already lost 2 major manufacturing employers in the last year. So that's how our rural areas are going to be particularly hit hard as they lose providers who are also big employers.